Well, lean has been in service industries only for about the last 12 or 13 years, and specifically in healthcare for around 10. So what we're seeing is benefits to quality and safety from a patient's point of view, and cost savings from a financial point of view, because by increasing the quality and taking away some of the waste, we're actually saving money. So what's different about lean is we don't pursue money or cost savings, we pursue quality, and out of that comes financial benefit. So that makes it attractive to both staff and patients, because we want quality, but also to the financial directors who are responsible for those cost savings. Lean is actually applicable across the entire healthcare organisation, and I think you can apply it to all patient care areas as well as support services, from pharmacy to lab to portering to housekeeping, all the support services for patient care. If I was going to start somewhere, I would start with something I can control, that is non-confrontational from a staffing point of view, and where there's quick tangible wins, and one of those areas would be pharmacy. In pharmacy we use a lot of product. We move product through the system, so there's hard dollar savings, and there's efficiency issues that, because they're the linchpin support service clinically across an organisation, the impact from pharmacy, if you start there, will be felt right out through the organisation. I think in pharmacy we've got some really hard cash savings to be had around inventory and supply chain issues. We're not particularly good at keeping an eye on what happens to medication leaving the pharmacy, so it can be wasted on the wards, it expires, it becomes obsolete, and I think that's straight money straight in the bin that we're doing nothing with. The other thing we sometimes do is bring that inventory back to pharmacy and attempt to put it back on shelving, even though it's more waste of time than it is the cost benefit. So really looking at the cost benefit from the inventory control, better supply chain management, better forecasting, so we actually look for delivery of drugs that we actually use based on actual uses as opposed to historical use, which we would have done in the past. So real hard dollar savings there, but I think there's also an opportunity to look at what staff are doing right now, so that we have pharmacists really maximising what they were trained to go to school in, and we leave technicians to do the technical jobs in the dispensary. Lean is very new in healthcare, but for about the last 12 or 15 years there's been a big movement. Maybe in the UK, in the NHS, we started to see them do lean as a way to save money originally, and then they realised that they could get some really quality patient care issues and still make some of those financial savings. When we look at the States, we see some very private hospitals driven by business, but what you see is very efficient staff working on the front line who understand delivery of high quality service will result in financial savings too. So there's a win-win both for money and for quality in those places. We also see in our work in Canada it's becoming huge that hospitals are process-driven, efficiency-driven, while keeping our eye on the ball for quality. And we're beginning to see some really big tangible results coming out of there, particularly in the pharmacy sector. There's hard dollar savings and really good quality initiatives going on there right now. I've worked in healthcare a very long time, and I would have to say that in 25 years, lean is the single most important thing that's happened to me as a frontline worker and happens to the organisations I worked in. It's the thing that makes the most sense financially and from a quality patient safety point of view, and we've got the win-win of the two things that are not mutually exclusive anymore if we adopt lean. What it allows us to do, deliver that patient safety thing that we absolutely have to get right and do better, and it's absolutely going to bring savings, because there's good evidence to show about 60% of everything we do today in healthcare in the Irish healthcare system is wasteful, and by cutting out that waste we are going to save an awful lot of money and still improve the quality of care we deliver.